Welcome to the Half Empty, Half Full Consumer Advocacy Radio Show. Listen in nationwide on the Tan Talk and Starcom radio networks with your host, Lori Zook, the consumer champion. Each week, we'll be discussing problems and solutions, changing negatives to positives, and helping you, the consumer, to learn something new. Get smarter faster and avoid scams and fraud. All opinions are that of the host and guests, and all shows are for educational purposes only and not to be construed as legal advice. Here's your host, Lori Zook.
Welcome to the show. Each week we'll be discussing problems and solutions, changing negatives to positives, and helping you, the consumer, to get smarter faster. Now, my guest today has been on a couple of previous shows. His name is Dr. Dan Madock, and he's a chiropractic physician. And we're going to be talking about what you as a consumer need to know about chiropractic non-surgical options for your pets in pain. Dr. Madock was just profiled on Fox TV for helping a dog, and we're going to be talking to that a little bit more about that story in a few minutes. I want to welcome you to the show and just share with our listeners a bit about yourself and your background.
Thanks, Lori, and thanks for inviting me to be on the show again. It's really a privilege. I am a chiropractor, and I am a certified veterinary chiropractitioner. What that means is that I use chiropractic manipulative techniques as designed by Dr. William Inman, who is incidentally not a chiropractor, but a veterinary neurosurgeon. He was summa cum laude graduate of Washington State Veterinary Hospital and director of their surgical unit. And he was dating a girl who was a chiropractor. And she used an instrument called an activator, which is a handheld instrument. Some of my patients refer to it as the clicker.
Okay.
And Dr. Inman borrowed one of these and started using it on animals and started getting some tremendous results. Now, his biggest concern was a lot of people can't afford the expensive surgeries necessary to rejuvenate their animals at times. You know, I know recently I had my Great Dane had to have a bloat, what do they call it?
Bloat?
A bloat surgery. And it cost $4,500. Well, that's really expensive and you know, a lot of money to put out on an animal that didn't cost that much in the first place.
Okay.
But when you fall in love with these animals, it doesn't matter sometimes. And so it's, what do you do? My animal needs this emergency surgery. And so Dr. Inman was saying, well, a lot of people can't afford these surgeries, so we're putting these animals down. Maybe there's an alternative. And so he started using this activator instrument and started getting some tremendous results with paralyzed animals, with animals in pain, with animals that were having bowel and bladder dysfunction, with hip dysplasias, and with wobbler syndrome. And so he developed a technique that he now calls veterinary orthopedic manipulation. And veterinary orthopedic manipulation uses a little bit more sophisticated instrument, but still it's a handheld device that we use that's very gentle. We don't try and crack or pop or twist the animal. What we do is we just gently tap the vertebra, and what we're stimulating is the posterior horns of the spinal cord, which then causes a reflex reaction, a muscular contraction referred to as a panniculus reflex.
Okay. Well, I'm going to ask you to hold your thoughts for just a moment because I have a lot more to ask you in terms of veterinary, chiropractic. You recently were profiled on Fox TV, and we have Rebecca Pierce on the line. Rebecca, are you there?
Yes, I am.
Thank you for joining us. Rebecca, would you tell the story of Wally, maybe from when you were, I believe, at Home Depot?
Yes.
All right, tell us what happened.
Well, the beginning of the story is I had taken him to a kennel, and he was in great shape when I dropped him off on Friday, and I picked him up on Monday, and his back legs did not work at all. So I realized I was going to need to get a wheelchair for him, so I watched a few YouTube videos, and I figured out how to make it, and I went to Home Depot, and the folks there helped me. One of the girls' names was Debbie, and she stayed with me for about 2 hours. And she cut the PVC pipe and picked the right joints and everything. And then Greg put the wheels on, and he spent about 45 minutes with me. So I bragged to the manager about those 2 employees, and he took our picture, and I sent it off to the news, and that was all great. Home Depot's awesome. So my neighbor is one of Dr. Dan's patients, and she knew that he did veterinary chiropractic work. So she asked me if I would please take my dog there because she was confident he could help my dog, I mean.
Okay.
So she called him, and I was able to get in 20 minutes. And Sharon's husband, Rudy, offered to pay for the service, so I was game. I was like, okay.
Nothing to lose, right?
I had nothing to lose. So I had taken Wally in. I believe the first 2 weeks he went in 2 or 3 times a week, and he got his treatments. And like Dr. Dan was saying earlier, you could see where he had reactions to the stimulation, but he wasn't in pain, and he seemed to not be frightened of the treatments, so they were pretty gentle. But I would say within 2.5 weeks, there was huge improvement in him. He could actually put weight on his back legs. He could not flip his feet so that he had the soles of his feet on the pavement. It was the tops of his feet.
He was dragging himself, basically.
He was still in trouble. But eventually, few more treatments, and he got better and better and better. And now he's at the point where not only can he stand on his back legs and walk, he's actually running.
Wow, amazing difference. And Dr. Dan, maybe you could share from your perspective, Rebecca bringing the dog in.
The first day she brought him in, I was concerned that we were going to be able to make any progress with him. One of the things that I discussed with Dr. Inman is as soon as you put a dog in a cart or in some kind of wheel device, they never walk again.
Because they lose what? The muscle?
They lose
muscles?
the muscles. Fortunately, we got him before he was in that for too long. And one of the things that we test for is deep pain. And that's where we pinch between those back toes where he's paralyzed. And if he reacts, that means there's still some nerve function there. And fortunately with Wally, I was able to elicit at least a mild, deep pain response. And so I was optimistic that we were going to make some progress. So we started using the accelerator device that Dr. Inman has developed. And then we did some myofascial work on the paraspinal muscles that go down the spine. And then we used what's called a Erconia PL5000 Class 2 cold laser, which is 635 nanometers at specific frequencies that stimulate the cells to produce energy and to transfer nutrients in and out of the cell and to reproduce proteins within the cell, which is basically what we mean by producing new tissue, healing.
Okay.
And Wally responded favorably.
Now, Rebecca, what kind of dog is Wally?
He's a toy rat terrier.
Okay, so he has a longer body, like some dogs do, correct?
It is, yeah, it is.
Okay, what would you say, Rebecca, was the difference between the first time and then what you had 6 treatments? Okay, so what was the difference between the first time to the 6th? Was it gradual, that he was just getting better each time where he could now fully walk?
Yes, I would say it was gradual.
Okay, and what is his demeanor? Does he seem much happier now? I mean, do you think Wally knows that there's a difference?
I think he does. The good news is he never did display any symptoms of being in pain, even when I picked him up that following Monday from the initial injury. He still had a very pleasant demeanor, and he wasn't any less energetic, which was very surprising. But now I know that he's enjoying getting around. He's a really smart little guy. I have wood floors, and he was slipping and sliding as he tried to walk on those, and he found the paths to the carpet on his own.
Smart dog. Very smart dog.
Yeah.
Now, as a result of the Fox TV segment, Dr. Madock, I know, has had other animal patients come in. How does it feel knowing? Because, when you think back to Sharon, to his patient referring you in there, did you think that was a little crazy?
I absolutely did. But she was so convinced, she was so confident that he could help Wally. And so was her husband, that, they put their money where their mouth was. And she actually drove me to the first visit and introduced me and, took care of the first payment. And I just thought that was amazing. But, yeah, I was very reluctant when she first said it.
What would you say to somebody that was thinking about it but wasn't sure?
I'd say do it. You've got nothing to lose.
Great. Well, I want to thank you very much for joining us today. Thanks, Rebecca.
Okay. Well, thank you for inviting me.
You're very welcome.
Thanks a lot, Rebecca.
Okay. Have a great day.
You too.
Thanks.
Bye-bye.
All right. Well, stay with us. We'll be back in just a second.
I've done my sentence, but committed no crime.
Consumers, do you have bad credit? Can't purchase a house or car? Paying too much in interest on your credit cards and loans? Scammed by credit repair companies? There is hope. You can get back on track and do it the right way. Call Credit Education Consultants today at 813-500-6064. That's 813-500-6064. Or go to crediteducationconsultants.com now and get the help you need. Don't delay. Call today. Mortgage reps and realtor inquiries are also welcomed. Do you suffer from back, neck, or body pain? Do you suffer from migraines or have jaw or face pain? Has conventional medicine failed you? Were you injured or in an accident? Call chiropractic physician Dr. Dan Madock at 813-935-1664. Dr. Dan has helped thousands of patients gain relief for more than 30 years. Dr. Dan is caring, gentle, and takes his time with each patient. He's also a past president of the International Craniopathic Society, a special certification of only 300 chiropractors worldwide. Dr. Dan helps patients from the neck up and the neck down. Dr. Dan accepts most insurance plans. Don't continue to live in pain. Call 813-935-1664 today. That's 813-935-1664 and get on track to better health.
Hello, I'm Jim Velasquez. Does getting a lousy 1% on your CDs make you sick to your stomach? Inflation is hovering at 3%, so what's really happening? Allow me, Jim Velasquez, to send you my free report. If you haven't reviewed your CDs in a while, don't get this report. It will break your heart. If you want to fight back and beat the bank, text RETIRE to 72727 for this free report. Let's beat the bank. Text RETIRE to 72727 for your free report.
I've paid my dues, time after time.
Welcome back to the show. I'm here with Dr. Dan Madock, and we're talking about animal chiropractic. And we were just speaking with Rebecca Pierce, who owns, we call him Wally the Wonder Dog, who is a little dog that appeared to be paralyzed and went for several sessions with Dr. Madock. Most people don't know that there is chiropractic available for pets, but Wally was able to walk after 6 treatments. He's actually walking within the first couple, correct? But then he ultimately ended up doing much better towards the end?
He was, within a week, he was starting to use those back legs. Within 3 to 4 weeks, he was up and moving, and usually what we do is we do the first adjustment, and then we do the second adjustment in 72 hours, 3 days.
Okay.
Then we do the follow-up in a week. Now, with Wally, we kind of squeezed an extra 1 or 2 in there to try and bring him back as quick as we could. And then he started responding just beautifully, and he was up and moving and using the legs each time better and better until the day we did it was October 27th, we did the Fox videotaping, and they brought the film crew in, and Cynthia Smoot from Fox News came in, and she was just absolutely charming. And we showed him, I had videotaped, and I videotape all of my veterinary chiropractic adjustments. And so I had each visit, she could take that and she could look at it, and they made a beautiful segment. You can either Google Dan Madock or go to Fox 13 News, or you can go to Facebook and type in Dan Madock, D-A-N-M-A-D-O-C-K. or you can actually, I posted it on YouTube. If you type in Dan Madock, you can see that video there. And it was just amazing the result that he had, and it came about. And I was concerned that we were going to make any progress at all. And since then, I have had another animal come in. His name was Charlie, a dachshund, who is, again, one of these long-bodied dogs, dragging his rear end. And after 2 adjustments, Charlie's up and walking again.
Well, let me ask you, what about the skeptics, who say chiropractic for animals? That sounds crazy. Of course, you have medical doctors that say that about people going to chiropractors, but with animals, what's your feeling? Like when you hear somebody skeptically say, that can't be done, how could that be?
I videotape every adjustment, and I videotape their progress. And we show them when they first came in, and then we show them the second visit, the third visit. We videotape the adjustment, including the laser treatment and the myofascial work, and then we show them pre and post.
Okay. Do you look at x-rays? Like, do you have a consultation with the veterinary where you look at the x-rays? I mean, I'm sure in some cases you might not be able to do anything.
I'm a veterinary chiropractor, certified through Dr. Bill Inman in the VOM technique. I never, ever, ever adjust an animal unless I have a consult with the veterinarian. Like to see the x-rays, absolutely, if any of them have been taken. And what I like to do is I like to recommend to the veterinarian what views I need, because there are specific views that show me the spine so that I can look at it, and I don't make a diagnosis, but I look at it and I can see, based on, I've got over 600 hours of postgraduate hours in radiology on humans.
Okay.
And I've worked with veterinarians enough to know what's going on in the spine. And so when I see the problem, I consult with the veterinarian, and I always get a prescription. I work under the direction of the veterinarian. Most of them I do in my office. I don't do the horses in my office.
Now, I was going to ask what other animals you have done.
Yeah, I've done dogs, cats, horses. One day I had a kindly old Geppetto-type grandfather who brought me his striped kitty. And the grandchildren had come over for the weekend to play, and they were playing with the cat and jumped off the couch and landed on the cat's head and dislocated his jaw. Well, the veterinary specialist said that they wouldn't be able to do anything until at least Thursday, and this is Monday. The cat hasn't eaten in 3 days. So they brought him into me, and we wrapped Kitty up in a towel and adjusted his jaw just with a little wiggling and movement, and I do cranial adjustments, so we set the jaw, and Kitty was just fine.
Feeling much better.
And no anesthesia. Cats don't do well under anesthesia anyway.
Wow, well, I mean, some real miracles here. Now, I think we also have on the line Mary Sanford.
Yes, how are you?
Good, how are you? Thank you for... Yeah, thanks for being here.
No problem, thank you.
Yep. Now, tell me, did you see the video? Is that how you found Dr. Madock?
Yes, I saw the video of Wally, and my friend saw it, and she sent me the link, and I watched it, and we looked up Dr. Madock.
Okay, and tell me a little bit about Charlie the Dachshund.
Charlie the Dachshund, he's 6 years old, male dachshund. He's, very hyper, very energetic, like any kind of little dog. But, about 4 weeks ago, he was, whimpering, getting on and off the couch or on and off the bed. So I took him into the vet, and it said, he had, an inflamed disc. And, after 2-3 days after the vet visit, it actually got worse, and I took them back. I took him back there, and they said that he needed surgery, and that's considered a crate rest for a few weeks. If not, he would ultimately need to have surgery, or else he won't be able to walk.
Okay, and I'm sure surgery was probably very, very pricey, correct?
Very pricey, very, very pricey. So they gave me, basically, it was given 2 options: pay for the pricey surgery or have your dog put down. I was given 2 options, and both were very drastic to me.
Yeah, I don't blame you. So I guess in a way it was lucky that your friend, saw the Wally story.
Yeah.
And that was your vet. What did your vet think when you said you wanted to bring in Charlie for a chiropractic treatment?
I think they were a little bit skeptical, but they were supportive. They sent over the referral for Dr. Madock to see Charlie. So I think everybody was skeptical, but, they didn't say no, you couldn't do it. I said I wanted to try an alternative treatment before, one, cutting him up, or two, putting him down. So
Right.
I went with, I followed my gut instinct. I was like, I don't want to do one or the other, and I was going to see, what I can do to help him out. I even looked into getting him a wheelchair.
Wow, okay, just like Wally had, exactly.
Yes.
How many visits did it take for you to see an improvement?
Oh, by the second visit. I mean, like the first visit afterwards, it was still the same. I wasn't able to take him to the second visit, and my friend took him for me. And when I picked him up that weekend, I mean, he was like kind of squeaming and didn't want to stay in my arms. So my friend was like, put him down. And I was like, no, I'm not supposed to put him down. Well, I put him down, and he kind of hobbled and was having more movement on his legs than a couple of days ago. So by the second treatment, I noticed a difference already.
That's great. I mean, how is Charlie doing now? Does he seem much happier?
Oh, much happier. Walking around outside, sniffing the grass, chasing his tennis ball, going through his toy basket. I mean, a complete change from like 3 weeks ago, where he was completely crated. He couldn't move his back legs. He couldn't stand up on them. Like, he was having problems going to the bathroom by himself. So, I mean, it's a night and day difference. And I've actually shown the 2 videos. We took a video of the first day that we were there, and then another video this past weekend when I was there. I mean, it's night and day difference. And everyone's kind of in shock, there was no surgery involved or anything. So everyone's amazed.
That's tremendous. What would you say to somebody that was maybe that's listening to the show that was thinking about it but going, yeah, it really, it sounds a little crazy?
It's crazy. I will be the first to admit that, I was skeptical myself when my friend sent me the link, but try it 100%. They always say, as long as you try, it doesn't hurt to try. And honestly, this did not hurt, and I would recommend it to anyone who has a dog or a cat or any animal that's in pain. And, everybody's first thing is do surgery or whatnot, but I would still recommend it. I mean, the last visit, I saw Dr. Madock. I gave him the biggest hug because I was so happy. I put Charlie down on the ground, and he's wobbling and walking towards Dr. Madock. I mean,
Aww.
I don't have any kids, so he's my child. So, I mean, it was devastating. For 3 weeks, I was like, I'm going to have to put my dog down or spend $7,000 on surgery. And the last 3 visits with Dr. Madock and his staff, I mean, has done wonders. Has turned our sad little story into a very happy and hopeful little story.
And that's what we love. And I think a lot of people refer to Dr. Madock as Dr. Doolittle. Because he helps the animals. Well, thank you very much for calling in. I really appreciate it.
You're welcome. I mean, I would recommend it to anyone. You can put my name out there. I recommend it. I'll 100% back that up. I love the results that Charlie has gotten from the 3 visits.
Great. Well, I think once we post this to the Facebook page, we'll take some of that video and put it up on my Half Empty, Half Full Facebook page so people can actually see what's possible.
They need to see his first visit video to his second and third video. I mean, you can definitely tell. Everyone will be very amazed to see the progress that he has made.
Great. Well, thank you again for calling in.
You're
Much
welcome.
appreciated.
Thanks, Mary.
No problem. Have a great day, okay?
You too.
Thank you. Bye. Well, Dr. Madock, talk a little bit about this dog. Was it the same exact situation or something similar?
Almost exactly the same. We had a little bit of deep pain. The veterinarian was very cooperative. They sent me the x-rays. They sent me all of their treatment notes. He'd had prednisone, he'd had Rimadyl, several different types of your standard veterinary anti-inflammatory meds. And there was no response. And so, needless to say, $7,000 is a really nice amount of money to get as a surgery, but maybe the dog wouldn't respond. And so $7,000 would be spent and the dog wouldn't be any better, which is a possibility.
Right. The recovery time would be long too, correct?
Oh, absolutely. Or the dog would be down and worse, or not survive at all. So as it is right now, the veterinarian didn't get to do $7,000 worth of surgery, but he still has a client.
Right.
And the main thing with my veterinary clients is they want to have an old practice. They want their dogs to live a long time because they continue to treat them. And so it's wonderful for them. And they get to do the examination. They get to do the x-rays. So maybe he didn't make $7,000, but over the years that the dog will survive,
He kept the client.
he kept a client.
All right, we're going to take a quick break, and we're going to talk about animal chiropractic a little bit more. Stay with us.
I've made a few. I've had my shells and kicked in my face, but I've come through. I need to go on.
Hello, I'm Jim Velasquez. Does getting a lousy 1% on your CDs make you sick to your stomach? Inflation is hovering at 3%, so what's really happening? Allow me, Jim Velasquez, to send you my free report. If you haven't reviewed your CDs in a while, don't get this report. It will break your heart. If you want to fight back and beat the bank, text RETIRE to 72727 for this free report. Let's beat the bank. Text RETIRE to 72727 for your free report.
Consumers, do you have bad credit? Can't purchase a house or car? Paying too much in interest on your credit cards and loans? Scammed by credit repair companies? There is hope. You can get back on track and do it the right way. Call Credit Education Consultants today at 813-500-6064. That's 813-500-6064. Or go to crediteducationconsultants.com now and get the help you need. Don't delay. Call today. Mortgage reps and realtor inquiries are also welcomed. Do you suffer from back, neck, or body pain? Do you suffer from migraines or have jaw or face pain? Has conventional medicine failed you? Were you injured or in an accident? Call chiropractic physician Dr. Dan Madock at 813-935-1664. Dr. Dan has helped thousands of patients gain relief for more than 30 years. Dr. Dan is caring, gentle, and takes his time with each patient. He's also a past president of the International Craniopathic Society, a special certification of only 300 chiropractors worldwide. Dr. Dan helps patients from the neck up and the neck down. Dr. Dan accepts most insurance plans. Don't continue to live in pain. Call 813-935-1664 today. That's 813-935-1664 and get on track to better health.
I've paid my dues, time after time.
Welcome back to the Half Empty, Half Full Talk radio show. I've been speaking with Dr. Dan Madock. He's not only a human chiropractor, he's also an animal chiropractor. Now, Dr. Madock, when you treat animals, is it usually that they've been injured in an accident or they have some type of a genetic problem? It could be either or?
It's their owner that brings them in. Sometimes they know what happened. Sometimes they don't have any idea. They know that their pet's not behaving normally or some part of their body is not functioning normally, and they bring them in. And we evaluate, and we begin our treatment, and a great percentage of them respond very, very favorably.
Now, you were talking earlier about an activator. When you perform chiropractic on an animal, it's not the same as, a human being lying down and you're manipulating them, correct? You're using a device. How does that work? Because obviously we're on the radio, we can't show a picture.
Well, if you visualize the video, what we have is, excuse me, the cervical spine is accessible through the spinous processes and at the base of the skull at the atlas vertebra where the head joins the spine. So what we do is we put the instrument on the spinous process and it fires off, or it activates it. It directs a pulse into the vertebra that stimulates the posterior horns of the spinal cord, and that causes a muscular contraction that not only sends a pulse through the nervous system and the spinal cord, but also the contraction of the muscles helps to pull the vertebra into alignment.
Okay.
Animals' vertebrae are not as accessible to adjustment, and especially large animals. I had the privilege of working with some veterinarians in Sao Paulo, Brazil, when I went down there, and they are killing themselves doing hard force adjustments. And I showed him this
Meaning
technique.
that they were manipulating them manually, like trying to use their arms
they're
to
doing
adjust?
thrusts, hard chiropractic thrusts like some chiropractors do on their patients. And you try to do that on a horse, or some of them even adjust tigers, and they're killing themselves. They're tearing up their wrists and their shoulders and their elbows, and it's hard on the animal, and it's hard on the practitioner. So I showed them a much easier way.
Okay. Now, obviously animals can't lie. So I would assume that if animal chiropractic works, you're going to see results. And I know you really can't give an average number, but when somebody brings in a dog, within how many visits do you make a determination whether it's working or not working?
Like I say, we recommend a series of 8. We start out the first day, then 72 hours, then a week, then 2 weeks, then 3 weeks, then a month, then 6 weeks, and then 8 weeks in between adjustments, and more frequently if necessary.
Okay. Well, I think we have Dr. Bill Inman on the line.
That is true.
I guess you could hear me. It's Lori Zook. How are you?
Yeah, I'm doing fine, actually. Sunny and beautiful, but cold up here in the Pacific Northwest. What can I do for you?
Well, I invited you to be on the show. Obviously, you know and train Dr. Madock. Now, you are a veterinarian and a veterinary neurologist?
I'm a veterinary surgeon. I'm in general practice, but I have a background in surgery and neurology, yeah.
All right, tell me, now I know you're the originator of the veterinary orthopedic manipulation. So tell us a little bit about yourself, and, Dr. Madock kind of described how you started it, but let's hear it from you.
Well, I will. I'll give you the Reader's Digest version of what happened, or at least how it happened, and that's just this. I got out of school relatively towards the top of my class, wanted to be a surgeon, developed a lot of specific types of surgeries that were complex, one of which was treating the kind of condition that Dan has successfully treated without surgery. However, unfortunately, the success rate for that surgery, decompression, amylomenectomy, nerve surgeries, essentially, has a poor success rate, but it was the only thing we did. And then sometimes people couldn't afford it. And one day, an animal came in that needed the surgery. The client couldn't afford it or wouldn't do it, and the only other alternative was to put the animal to sleep. At that time, my associate that I was working with had a chiropractic background and suggested I use chiropractic care or an adjusting instrument to adjust the animal, and of course had not heard of any of that in veterinary school. So I thought she was crazy, but out of desperation we applied it, and it worked, and it continued to work, and this was 1982. During that period of time, it was very easy for us to see that a quick and easy, safe, and very, very effective technology was just sitting there waiting to be developed, and I developed it in my practice in Seattle, Washington, for about 15 years, thinking nobody would be interested in it. And we started then teaching it in 1997. I think in 99, Dr. Madock took my course and started to apply it as something I can teach a veterinarian or a chiropractor, actually in a matter of hours, and it's incredibly safe, 100% safe, but it's about 91 to 93% successful. Since 97, when we started to train people to do this, we've trained 8,300 doctors, about 50-50 vets and chiropractors. We'll deliver a course just like the one Dan took. We'll deliver it on Friday of this week in Florida, actually in Tampa, to probably about 20 vets and chiropractors in your area. And I'm just rattling off information so you have an idea. But we basically, as a surgeon and neurologist, we would operate or treat this animal surgically or with medicines and cross our fingers. Now what we do is we just fix them with this non-invasive technique that has about 3 to 5 times the success rate that we used before. And, of course, Dan's a classic example in these cases that you've seen with Dan, classic example of what we do every day, essentially. And so do my students throughout the United States, throughout the world now. So I'm going to stop talking and let you ask a question.
No, that's great. A lot of information is good. Now, let me ask you in reverse. What would you say to skeptics? Because I would assume, like Dr. Madock, that you probably video the conditions of the animals when they come in, and then throughout the process to show what the results are. Because there might not always be results, but I'm assuming it sounds like there are a good percentage of the time. So you're training veterinarians and chiropractors in these techniques. But what about the veterinarians that say, hogwash, this isn't going to work? Or, are there times when a veterinarian does not want to do a consult or give a script to get this particular method done?
Well, luckily, it is not as common as it used to be. At first, in 1982, when I did this, people thought I was crazy. They just ignored me. And then, in the late 1980s, people realized how valuable it was, and then I was attacked vehemently. It cannot possibly be correct or this easy or this effective, so I must be a scam artist or what happened. And after that, essentially, then it finally became a self-evident truth because we had virtually hundreds of thousands of clinical cases. And after you've basically successfully treated hundreds of thousands of cases and they have the data on that, you're really hard-pressed to not get on board with that technology. However, my profession, the veterinary profession, are trained absolutely nothing as far as chiropractic neurology or chiropractic care. And this animal adjusting technology could then be considered as treating the neurological interferences, kind of which is what the chiropractor does. So when a veterinarian hears the C word, chiropractic, they think of somebody trying to aggressively pop a bone back into joint with a resounding crack and thinking that inherently will injure the animal. Some manual techniques could do that too, but this is not a technique that does that or can do that. So already you have two strikes against you. One of the main things that I teach my students or the docs that take my course is they have to disabuse their veterinary affiliate of that misconception. Otherwise, they're basically got two strikes against them right off the bat because the veterinarian thinks that it is bone or joint relocation, like a dislocation relocation thing, and that's not what it is.
Right. People would think it was like a human adjustment, but it's not.
Well, there are a number of techniques in human adjustments that basically do this type of thing. There's about, 135 different chiropractic techniques out there, and a lot of them that work through this technique. But on the cellular level, essentially, this particular instrument allows us to effectively take care of this in the quadruped. And interestingly enough, the quadruped are neurologically different. Animals that move horizontal instead of vertical like the human being are different neurologically than people. So we have a whole series of pathological reflexes that are facilitated by this neurological interference, and it takes all the guesswork out of where we have a neurological interference, essentially, and how it is to treat the animal, where to treat the animal, and if the animal's been treated correctly. It's kind of like objectifying this, cookbooking this technology, essentially. It makes it incredibly easy and very easy for us to teach somebody how to do this within a couple days, really.
Now, are there, excuse me, any official studies done regarding your techniques? Do you keep the data? Are there studies to show that it actually does work?
Yeah, actually, there's been a lot of it. Interestingly enough, when I started doing this in '82, I got really nervous because the results that I was getting were fabulous. Of course, everybody's going to tell you that about their technology. But I was worried that somebody would come along and say, well, where's the research about that? Well, I found out that the research was extensively done by a chiropractic researcher, Madock Chiropractic, out of Life Chiropractic West. And he did this research with fine needle probe EMG, which is a scientific method to scientifically evaluate these adjustments. And he did almost all of that research on beagle colonies. So all that work was already done on beagles, essentially dogs, before we even started delivering this technology. And, of course, we've come up with virtually hundreds of thousands of clinical cases, essentially, for the last 18 years of teaching this. But I've been doing it since 1982, so I've probably got about 150,000 of these cases under my belt, too, all of which we've, put into medical records, so they all sit right there, and so they're kind of undeniable. So, yeah, there's lots of research that's been done about this specific technology, both on a scientific basis, also on a clinical basis, too, for which becomes kind of anecdotal, but, I mean, after thousands of cases that are successfully treated, it stops being coincidence.
All right, well, can you stay with us? We're going to take a quick break, and when we come back, we're going to talk a little bit more.
Okay.
Do you suffer from back, neck, or body pain? Do you suffer from migraines or have jaw or face pain? Has conventional medicine failed you? Were you injured or in an accident? Call chiropractic physician Dr. Dan Madock at 813-935-1664. Dr. Dan has helped thousands of patients gain relief for more than 30 years. Dr. Dan is caring, gentle, and takes his time with each patient. He's also a past president of the International Craniopathic Society, a special certification of only 300 chiropractors worldwide. Dr. Dan helps patients from the neck up and the neck down. Dr. Dan accepts most insurance plans. Don't continue to live in pain. Call 813-935-1664 today. That's 813-935-1664 and get on track to better health.
Hello, I'm Jim Velasquez. Does getting a lousy 1% on your CDs make you sick to your stomach? Inflation is hovering at 3%, so what's really happening? Allow me, Jim Velasquez, to send you my free report. If you haven't reviewed your CDs in a while, don't get this report. It will break your heart. If you want to fight back and beat the bank, text RETIRE to 72727 for this free report. Let's beat the bank. Text RETIRE to 72727 for your free report. Hello, I'm Jim Velasquez. Does getting a lousy 1% on your CDs make you sick to your stomach? Inflation is hovering at 3%, so what's really happening? Allow me, Jim Velasquez, to send you my free report. If you haven't reviewed your CDs in a while, don't get this report. It will break your heart. If you want to fight back and beat the bank, text RETIRE to 72727 for this free report. Let's beat the bank. Text RETIRE to 72727 for your free report.
I've paid my dues. Time after time.
Welcome back to the Half Empty, Half Full Talk radio show. I have Dr. Dan Madock with me, and I also have Dr. Bill Inman with me. Now, Dr. Inman, I was looking on your website, trying to do a little research. What is veterinary myofascial release, and what benefits does it have?
It actually is a means to, when the animal has neurological interference, that we treat with the VOM technology, which is basically just flipping the switches back from the offside to the onside. Very easy to do, like you would your circuit breaker in your house. Then also they leave with them a residual of muscle tension that we can actually reduce back to zero. Now, if we don't do myofascial release, eventually the muscles will come back to their normal tonus, range of motion will be restored, and the racehorse can now win, or the animal that has spasms that can't move, essentially, or the miniature dachshund that's pinching a nerve, essentially, through the muscle spasming, isn't doing that anymore. What we can do with myofascial release is reset the Golgi tendon organ and muscle tendon fiber, which are technical terms for what's going on in the muscle itself, back to normal, make them normal muscles. Eventually, they will go back to normal if we keep adjusting, but we can put them weeks to months ahead of schedule by doing myofascial release, which only takes a minute or so when we make the adjustment.
All right. Now, when you train people, are there different laws in each state as far as what types of doctors can be certified? And how does that work? Is it different?
Yes, it is. However, in general, throughout the United States, what is allowed for the veterinary professional to basically bring any other kind of specialist, a dentist, an MD, a nurse, a physical therapist, bring any other, and a chiropractor into their practice to do this work, as long as they're kind of the affiliate or formally affiliated with the case. Essentially, every state, including your state, I think you're in Florida, are you not, Laura?
Yes.
Yeah. Your people in Tallahassee have looked at this, and they can find that there's absolutely no reason that a DC can't do this work, essentially, as long as they're working with what's called veterinary affiliation. That means that there is a licensed veterinarian somewhere along the line. About 60% of everyone who walks into a chiropractor's office has a pet, and every one of them have veterinarians. So we train our people who are not licensed veterinarians to approach and work with licensed veterinarians to make sure that a differential diagnosis is ruled out. Tumor, fracture, some other metabolic disease is not a consideration. About 9 out of 10 times it's a neurological interference associated with the vertebral subluxation complex that we treat, and then we're off to the races. We have about half of our people are vets. For instance, we've got about 30 vets in the Orlando area, but the other half, about 55 to 60% of them are doctors of chiropractic who have been approached by their clients who believe in adjusting as a technology, see the problems in their animals, and then option to have that work done or want to have that work done on their animals, essentially, in that capacity. And so chiropractors are continually being asked, even chiropractic students are continually being asked to adjust animals.
Now, can you share with me what's your favorite personal success story with an animal?
Well, Well, the first one, I think that Dan was talking about a dog that was down, for instance, acutely down, and I had one that was like that and had a condition that was known as was known as a fibrocartilaginous embolism, and that's a middle-aged dog that can't walk. All of a sudden is paralyzed from the rear legs, and so the dog went to a very excellent vet who did everything he could, and then sent the dog to a surgeon who did an MRI and a myelogram, and then sent it to a neurologist, and then was diagnosed by rule-out because you can't really diagnose that particular phenomenon unless you autopsy the animal and look at every millimeter of their spinal cord under a microscope. So that was the diagnosis, and of course the diagnosis of that condition, fibrocartilaginous embolism, is kind of the animal's going to die. The dog was brought to me to be put to sleep as a fourth or a fifth opinion, and we went ahead and I was going to show the owner where the section of the spinal cord was actually dead. There was a section of the spinal cord dead in a fibrocartilaginous embolism, and I made an adjustment in this animal's atlanto-occipital area by the neck. The dog had been down for 3 weeks. Got up and started chasing my hospital cat throughout the hospital, barking his brains out. And the owner looked at me and she said this. She looked at the device I was holding and she said this with her mouth open. She says, "Are there batteries in that thing?" She didn't know what to say. And then I looked at her and I said, "Well, is what, candid camera guy going to jump out and say you're on candid camera? What's happened?" But that kind of thing, those kind of what we call Hail Mary conditions, occur over and over. Virtually everybody who's taken the course ends up running across one of those essentially, either sooner or later, essentially. And so I've got hundreds of them like that.
Now,
that's the one that came to mind right off the bat.
Yeah. Do you think that most veterinarians across the country are aware of your technique?
Absolutely not. We have sent, for instance, in Florida alone, if you've got a DVM behind your name, you have gotten at least 3 huge postcards about this course 3 times a year for the last 17 years. And when I talk to people, when I'm at the National Veterinary Conventions, if they've heard about the Vion technology, they say, "Well, that's great. We've never heard of that before." Well, they've probably thrown away at least 3 dozen postcards that are sent to their practice that basically invite them to take like the course I'm going to deliver this weekend. So they don't know anything about it. And although it shows up in various news magazines, etc., and situations like this, they don't know anything about it. And we're peddling as fast as we can, but the fact of the matter is something like this is hard-pressed to get to my colleagues. And it's hard to get it published in lots of different journals because it's not sponsored by the drug companies, and not that there's any problem with the drug companies. It's just not. It's not the kind of thing that is continually promoted in the various trade magazines.
Right. It almost sounds like the same thing with medical doctors versus chiropractors. A lot of people don't even know what it is, or they're afraid because their perception of what it is.
Right. Well. And so therein lies my biggest problem. Also, I would say my biggest problem has always been that my colleague, the veterinarian, does not know what a chiropractic technique is. They think it's a bone being snapped physically back into joint, and he's thinking that that's going to harm the animal that has an acute neurological injury in the spinal cord, and it would be detrimental instead of beneficial. And they just don't get it. So this weekend, I'll spend a bunch of time explaining to my students, or my docs that are taking the course, how to talk to the veterinarians and disabuse them of that misconception, because that's elemental in getting this. And then once the veterinarian's on board with that, they find case after case after case after case that they can use, and they'll keep them as busy as they want, like Dr. Dan is being kept busy by his veterinary affiliate.
Right. It's interesting. We had a couple of callers where the owners of the dogs called in. They were Dr. Dan's patients, and the last woman that called in was talking about how the veterinarian said, it was a $7,000 surgery with no guarantee, of course, or put the dog down. And if she had seen the video, she would not have known it was an option.
All right, so this is an important consideration, because in deference to my colleague that is making that response, which we know is not true now, he doesn't know that's not true, and he's responding right out of his training and right out of the textbook. One of the Bibles for veterinary medical therapy, called Kirk Veterinary Therapy, and recommends for these kinds of things that Dan has treated, these kinds of things, surgery, and if not surgery, steroids, and if not steroids and surgery, euthanasia. And so, unfortunately, you can see that for the last 30 years really doesn't need to be done.
All right. Well, you've been a wealth of information. If anybody wants to reach you, do you have a phone number or a website they can go to?
I'd have them go to the website. We support all the people that we have trained for free on the phone. That's people I've trained. I can't really converse with people about their cases because I am not licensed in their state. I'm not licensed in Florida, so one of your Floridians can't call me up and say, what do I do with my dog? I give them Dan's number, and then Dan can call me up and I could talk about that. But I can't really talk about a specific case. However, they can find a practitioner near them if they go to VOMTECH.com. D as in Victor, O, M as in Mary, TECH.com. And they'll get a website. And actually, I think the first video that's on that website is I put on Dr. Dan's doggie that he treated there, and it was recorded by Fox News because it was done so well.
Right, that was the Wally the Wonder Dog.
Yeah, I think so. They get a chance to see that again if they want to. It's kind of nice. Plus, there's a whole lot of other ones.
Great. Thank you so much for joining me.
Okay, well, thank you for getting a chance to take care of this and remind Dan that I will be in Florida this weekend, and he's welcome to swing by and say hi. Okay?
I'll be there, Bill. Thanks.
Okay.
All right. Well, Dr. Madock, before we wrap up, any other thoughts that you'd like to share regarding animal chiropractic?
Well, one of the things that I like to do is recommend some of my veterinary affiliates. One is Dr. Trish Callenbach in Brooksville, who is a veterinarian who does this technique. And I've also worked with Dr. Marlene Siegel at Pasco Veterinary Center on Highway 54 in Land O'Lakes and Lutz area. And she had me in her office. I've known her for 25 years. And I was treating animals in her office, and she saw the veterinary orthopedic manipulation techniques being so successful that she went and got trained, and now she does those techniques in her office, and she's tremendous.
All right. Well, thank you for joining me today. Can you give out your contact information?
I can be reached at my office, which is 813-935-1664. I'm in Temple Terrace. You can find me on the web at drdanmaddock.com, or you can find me on Facebook. Just type in Dr. Dan Madock, or you can reach me by email at www.drdanmaddock@hotmail.com.
Great. Thanks again for joining me, and join us every week for a new Half Empty, Half Full Talk radio show. Learn something new and get smarter faster. Be safe.
Frozen. In that instant when the puck appears in the back of the net. In that moment when jaws open in astonishment. In that second, everything stands still. But the next second, you are the energy that shatters the stillness. The Tampa Bay Lightning. Be the Thunder.
Lightning single game tickets are on sale now. Visit TampaBayLightning.com or call 800-745-3000.
You're listening to the Tan Talk Radio Network.